you're in the right place. Dr. Kris Wusterhausen has been in your shoes, and he's done the work and can show you how you can turn things around. In this podcast, he'll share his personal stories and advice on how to create the life you want for yourself as a provider and as a business person. You'll learn how to reclaim your life, your time, your energy, and most of all, reclaim the dream you had when you started your journey to become a doctor. Welcome to the Dr. Kris Podcast. All right, we're back, and it's the Dr. Kris Life Podcast. We're talking with Dr. Kris. We've been covering some great conversations. Dr. Kris, how are you?
I'm good. Everything's good down here in Dallas, Fort Worth. The weather is getting a little hot again, though. But other than that, life is good.
So we've been walking through some conversations here. The folks that listen to this, they're considering how they're going about their practice. We have providers that are struggling with common villains, insurance, dictating your practice, high volume, low yield. There's just all these things that come into play that it makes it feel like a big struggle trying to be the doctor that you envisioned you would become when you first started down the path of becoming a provider. Revisit a little bit about why you dedicated this process to help people with their health.
Yeah, well, it's kind of a multi-step process, but the biggest thing that I talk about, and I'm putting a lecture together right now for Vegas in about 4 weeks, and I actually am kind of starting my PowerPoint slide about myself and just, really talking about how I looked up one day and saw my own health, trending in the absolute wrong direction. And I just simply, it was many factors went into why my health was not doing great, but and hormones certainly were a role in that. And you and I have talked about that, and I'm sure we'll talk about it more down the road. But so much of it was the stress, waking up early, getting to the clinic at, 7:30 in the morning and already having a stack of charts that you hadn't finished from the day before, trying to get through those, trying to see. I worked in even though I was although I am a family practitioner, I worked in mainly an internal medicine practice. It was a county medicine practice, very ill patients. I joke, but I'm not joking. Most patients took double-digit medications plus. It was rare to see somebody that took less than 5 or 6 meds. And you just started your day and you started seeing these patients, and I averaged about 30 a day. And I just never really felt like in my heart or in my soul after doing this for years, I was really helping these patients. And I'm not trying to say that those patients don't need help. And like the doctor who took over for me does a great job of helping those patients do the best they can. But really, I think we've missed the boat with many of these patients. Like, wow, like if I could get my hands on patients before they get to that step where they're taking 10, 12, 14 medications. I used to look at these medication lists and go, how the hell is all of this not interacting with each other? And by the way, I think it is. I just don't think you can take 15 medications and things aren't, I'm taking this for the side effects of that and that sort of thing. I've come to believe that I bet you could take them off of 80% of those medications and they would actually do better at the end of the day simply by getting off of all the medications. So I noticed myself becoming overweight. My labs were trending in the wrong direction. I just wasn't mentally or physically happy with anything. And I made the decision that, oh my God, I can't do this. At that point I was mid to late 30s is kind of when I started making this transition. I said, I can't do this till I'm 70. I just can't. And I don't consider myself a quitter. Like when people ask, when do you plan on retiring? I don't ever plan on retiring personally. I don't. I guess if unfortunately my health fails me in some way, I would retire, but I enjoy what I do. I don't want to retire, but I realized that I realized I was kind of in trouble when I was seriously Googling at night, like other things that I could do as a doctor that didn't include doing what I was doing. And And then at the same time, I've got my health failing, and I found some different organizations that really specialized in, hormones and fitness. And these were things that were really, we're talking 16 years ago, 15, 16 years ago, it was really a kind of a just starting field. And, I said, wow, I'm really interested in this because, as you and I have talked about before, there is this perception that most doctors know everything, first of all, about health, but they know everything about nutrition and exercise and hormones and how to live healthy. Bullshit. I tell everybody I was given a 30-minute nutrition lecture in medical school that taught the food pyramid, the biggest, a pile of bullshit you could ever throw at somebody. And hormones were like maybe a 30-minute lecture. And every doctor I worked under told me something totally different about hormones. I left medical school and residency not knowing crap about that. But then now I'm the expert. I'm supposed to tell Steve Brown how to eat, how to exercise. And I look back at the stuff I told people and I'm ashamed. But, at the time I thought it was right. And so I wasn't lying. I just was ignorant, but didn't realize I was ignorant. And, I was lecturing the other day in Nashville, and one of the docs said something that really I've always had a hard time verbalizing, and it's something we deal with every day. And it is that if a doctor is not up on something, he or she's naturally down on something. And it's something we run into all the time here. Like, well, my doctor says that what you do is bad, or my doctor says hormones are bad. And, basically what we're saying is if they're not caught up, if they're not up to date on current scientific data, they're naturally going to have a negative opinion of that, because doctors, not everybody, but most providers are very, very, cautious at simply saying, you know what, Steve, I don't know the answer to that question, which I think is so silly, because I firmly believe patients would respect the fact that you say, oh yeah, like, you know what, if you're having this crazy rare heart ailment, I'm not expecting you to know more than a cardiologist. That makes sense to me. Yeah. But providers, a lot of us have egos, and we're, I think, very afraid of admitting to our patients when we are not current on a topic. We're afraid that they're going to lose hope in us, or confidence in us, I guess is what I'm trying to say, I believe. But I think actually, in a weird way, you somewhat gain the confidence of your provider, because I've always found it very, very important. And you and I had an off-air discussion before we jumped on about nutrition. I've always found it very important for me to relay to my patients my own shortcomings. They need to know that I struggle just like they do. Like, they need to know that I ate that humongous ice cream sundae on Saturday night, even though I shouldn't have, because I didn't have enough willpower to push it away. That just makes you human. And they understand that. And then you can talk to them about here's maybe some things that I did after that to try to kind of counterbalance that.
I think, the traditional practices, when I remember going to the doctor, here's their advice: you just keep doing what you're doing.
Yeah.
Like, if you knew what I was doing, would you really say that? But it's like we didn't have time to have a conversation. We didn't have time for me to ask a bunch of clarifying questions and really figure out what I should be doing.
Yeah, or they get the very, very basic labs, which, by the way, I was guilty of forgetting for a very long period of time. That I tell my patients that basically tell me if Steve is okay right at this moment in time. It doesn't really predict much for down the road, 6 months, a year, 18 months down the road. But right now you look fine. Your blood pressure's okay. You're a little overweight. Just keep doing what you're doing. You're okay. And I always joke many times it's because they're in the same situation as you are. It was the reason why in my slide deck I put like a funny cartoon of like an overweight doctor, and I said, I wasn't quite this bad, but this is about what I was. And it's like testosterone levels. My doctor said my testosterone level's good, and I go, how old's your doctor? Oh, he's 70. I'm like, well, hell, it's probably better than his, so he thinks it's fine. It's just, traditional medicine. God bless the providers that do it. I have so much respect for them. By no means do I ever want to come across that I'm, being disrespectful towards them. I just simply couldn't do it any longer. I thought for myself there was a better way. I think for my patients there was a better way. And so, the good news is that there's always going to be patients that do not want to step out of the box at all. They want to use their Blue Cross Blue Shield, and whatever it covers, and whatever it doesn't cover. And I'm not spending an extra penny because I have this insurance policy. And then I have a lot of patients that view that insurance policy as an insurance policy. It's an insurance policy if all hell breaks loose, despite me doing my best. If I have a heart attack, if I have a car wreck, if I don't know, fall through my ceiling when I'm in the attic and break my pelvis, I've got insurance to cover me for that $200,000 hospital bill that I could possibly have. But that's all they look at it as, a catastrophic policy to protect me against that. But they understand the value that at the end of the day, those insurance companies really aren't out there. They don't exist to keep you healthy. They don't. And anybody who thinks they do is not looking at it correctly. If they did, they would cover a lot of these things that we know help patients. Doing these bigger lab panels, looking at things down the road, predicting diabetes 5, 6, 7 years before it occurs so that we just fix it. Every week we have a few patients that we find someone trending towards diabetes in the very early stages that wouldn't have been found otherwise. And we make interventions and we fix things, just like you and I were talking about before we got on this podcast.
So, that comment about how insurance is not designed to keep you healthy. And as a provider, the insurance companies are not designed to keep your practice healthy. And when we talk about, the topic today is high volume, low yield versus low volume, high yield. And that insurance company is designed to keep your practice at high volume, low yield. No?
Yeah, it's the only way you can exist. Because every provider, every doctor that goes through medical school residency makes the sacrifices to get to that point. It's tremendous. And they deserve to make what I believe to be a reasonable living. There is a lot of people who make a lot more money than doctors who didn't have to go through all of that. And this, I've heard sometimes I've had people say, well, doctors make enough money. I think you'd be surprised if you saw what primary care physicians average per year and go, wow, that's not that big of a number for what they go through. And then if you had to spend a day in their shoes of actually seeing those patients day after day and the paperwork and the stress, and any good provider is going to take on the stress of their patients because they're in the foxhole with them. It's not a complete disassociation from that person that like, hey, I'm sorry, sick and all this going wrong. I really don't care. That's not true. Providers, the vast majority do care. That's why they're doing it. I probably cared too much. That's probably why I got into that point to where I got. And so insurance-based practices primarily, because it's the only way you can make a living, is high volume, low yield. Simply, I got to see a lot of patients because I'm not bringing home a lot per patient. Not only what the insurance pays me, but the overhead is extremely high. As I talk about, we used to have 4 providers at the clinic I was at, including myself, and we had nearly 30 employees total to make that clinic function. I think it was 25, 26 when I left, total employees, to do prescription refills, to do prior authorizations, to collect the money from the insurance company, to check you in, check you out. The list goes on and on of the things that you have to have in a high volume, low yield traditional practice. And then I moved over to my low volume, high yield practice. And what does that look like? I was seeing 30 plus a day. On my normal busy day, I probably see anywhere from 12 to 15 a day. So I see a little bit less than half. I'm able to actually spend 30 minutes, 45 minutes with my patients. I'm able to get things accomplished with these patients. I'm able to have real conversations with these patients. I get to know my patient. I can get to know these patients so much better in 2 visits than some of these patients I've been seeing for 2 years, because I have that ability, that time. You need that time in order to get that rapport with your patients, to get them to trust you, to really open up. and just the knowledge that I'm not bound by what Blue Cross Blue Shield says I can, and I hate to pick on Blue Cross Blue Shield, United. We'll move over to United for a second. I'm not bound by United to be able to do only what United says, because as you've heard me say, you don't really work for your patients in that scenario. You work for the insurance companies. The insurance companies dictate to you what you can and can't do, what you can and can't order, what prescriptions you can write. It's absolutely dictated by the insurance companies. And anybody that says it's not is wrong. And they'll say, oh, well, you can do a prior auth. Well, how many prior auths can one person do in a day? I talk to providers all the time, and they're trying to enact laws to basically limit these prior auths, because even our government is acknowledging how much of a burden this is on clinics. So what ends up happening is you write a medicine for Steve, and Steve takes it down to Walgreens. Walgreens says that's not covered, and then you end up just going, well, what is covered? Like just tell me what's covered so I can write something for this guy so I can move on to my next one. I just don't have the time, and so it's just a scenario. Or I want an MRI because Steve's got sciatic pain down his left leg behind his knee, and the insurance company says, well, it's only been going on for a week, so you're going to have to do this and this for the next month, and just let the patient suffer, even though they've got a disc herniation, but you just need to document it so you know how to properly treat them. These are the things that you run into, which luckily here we have an agreement with our patients. We make decisions together. I always tell my patients, you're in charge. I'm here to guide you. The only time I'm going to get ruffled is if I think you're making a silly decision. But I'm here to educate you and ultimately let you decide what's best for you, not me. But I'm there with them in that foxhole.
Yeah, that foxhole. I think most patients would love to have a longer conversation with their physician. They would like to understand things, but when a physician's like in a hurry to get to the next patient because they have to, they got 30. Yeah, how many times you got in for an appointment, you have to wait an hour and a half, and your appointment was, that's just seems like there's a lot of things being dictated for traditional practices that are at cross purposes of your original intent of becoming a healer.
Yeah, and you just scheduling in primary care, you just can't stay on. It's when you're dealing with sick patients, you just never know what you're walking into in a room. And I was talking to another primary care physician that's still in that traditional model last week, and he was actually coming to see me. And he texted me. He was my last patient of the day, and he said, "Man, I'm gonna have to reschedule. I'm running late." And I said, "It's fine. Just how late?" And he's like, about 45 minutes. I said, "It's the end of my day. I'll just do charts, But he comes in, he's like, "Yeah, the last patient of the day threw all this stuff at me. And I was already running 30 minutes behind. That threw me an hour behind." And I said, "Man, I get it. You just can't control those scenarios." And patients were grumpy all the time because no one likes sitting for an hour out in the waiting room. I used to joke at my traditional clinic, if you weren't sick when you came in, sit out in the waiting room for an hour and you would be sick, with everybody coughing and hacking. And, I'm not going to try to say that we're always on time here, but we're reasonably always on time here. We're able to schedule our patients for appropriate amount of times. About the only thing that wrecks my day is when somebody shows up late and we go ahead and see them, and then it just throws everything off. But luckily, my patients are pretty courteous. I think patients really appreciate that model too, because going back to what you said, like waiting on a doctor 90 minutes, doesn't that kind of sometimes make you feel like we think as a traditional doctor, your time's not as important as our time?
Right.
Like, sorry, Steve, I know you had like important stuff to do today, but now you're going to take a whole afternoon to see me for 20 minutes, 15 minutes, because you're going to, you took 20 minutes to drive over to the office. You checked in, that took 15 minutes. You sat in my waiting room for an hour and a half. And then I finally saw you. And now your 15, 20-minute appointment's taken nearly 3 hours. And now you're like, screw it, I guess I'll just go home. My day's shot. Time is money. These days, people just really can't afford, many people can't afford to lose a half a day for a simple visit. And I think that's why they're understanding the value of what we do, of keeping you on time. And heck, I see a lot of my patients via telemedicine. We really try to we really try to work with their schedules and try to show them that we think their time is just as valuable as our time.
So if I was, I want an aspirational image of what I actually could realistically expect, should I consider becoming more of a cash pay provider? Draw a picture for us. Help us understand a little bit of what is reality for you, at least.
For the provider themselves.
Yeah. What
Yeah.
can they?
Well,
It
you're able to
sounds
cut your
great.
yeah, you're able to cut your overhead so tremendously. And I think that maybe doctors, if they just take a step back and say, if I was just charging cash, and if I agreed that we're not going to use insurance, how many employees would I really need to pull that off? We've just recently grown over the last decade to where we have, I think, 9 employees now and 2 providers, 2.5 actually here in the office. Excuse me, in Texas, I mean, not Nashville, not Tennessee. And so, which I could never have imagined my staff being this big. For years, I ran it with just myself with 2 or 3 people. So it'd be 4 of us total, four total employees. I needed somebody to answer the phones and check people in. I needed somebody to room the patients, and I needed an office manager, and I needed myself, 4 people. And we were able to very, very efficiently run a practice. And the truth is, if I didn't want to grow the practice, I could have kept it at 4 people and just said, hey, we're full. And, we're making enough, I don't need to be ambitious. Let's just keep the ball rolling. And sometimes jokingly, I wonder why I didn't do that. You grow your practice as you see fit and you add people as you need to, but I'm nowhere near the overhead that we had. And then, you charge $125 for a visit, and Blue Cross Blue Shield comes in, or United or Aetna, and says, well, yeah, but you're contracted at $65 for that visit. So even though you charged $125, you got $65. And that's what throws patients off. They look at what was billed, not realizing what was billed and what was collected are 2 different numbers. And to my providers, this is what I would say is, what I bill, I collect. Our patients, when they check out, they pay their bills and they know what things cost. We don't hide things from our customers, and they come in, they get seen, they know what the visit's going to cost. They either pay cash or debit card or whatever, and they pay for their visit at the end of the day and they leave. But they see the value in it. And I know it's a really scary thought to providers, like, oh my God, there's not that many people. You would be very, very pleasantly surprised at how many people truly have figured out that the traditional system fails them. And many patients are very well educated these days. They do a lot of their own research when they come in. Some of my patients at times will give me a run for my money on education when, just topics and, like things that they've already thought their way through. They're not just coming. When I was doing traditional medicine, and again, I don't mean this bad, but I felt like 98 out of 100 patients were just wanting me to tell them what script they needed to go fill at Walgreens. Like, what are you doing today? Well, I'm adding this medicine. All right. Any side effects I should know about? Yeah, it's going to make you grow 3 years. Okay, cool. Bye. And they would leave. They would just take it, and I really never felt like I had those true in-depth conversations. I get a lot of value out of helping people before we help people that are ill. Don't get me wrong, but I get my biggest satisfaction out on getting a 40-year-old guy or girl and fixing all of the problems before they've caused all the problems, that the chronic illnesses. And we can easily say, I look at labs all the time, like, oh my God, we just reversed all that metabolic disease that you had on this lab work. Look. And patients are very, very excited themselves. Even when I see doctors get proud of themselves when I see them and I help them make all these changes. And so it's just for providers, I would just say it's a very rewarding thing overall.
Yeah. So when you think about the cash pay practice, your patients are a different quality. There's a different experience there that's adding to your stress. You got more employees. You're actually a business person first, then a physician. There's a lot of things that are going on in that traditional practice that are attacking you being an astute business person. Would you agree with that?
Yeah, and I mean, and, and it's not all roses and daffodils on this cash pay side. The one thing that I've struggled with is actually trying to be so, like I never dreamed I'd have to do social media and podcasting, and the podcasting I enjoy, the social media I do not. But there's aspects of, because now I am a physician, but I'm also having to be a true business person as well. Um, you know, Everybody has to be a business person, but in that traditional model, I found it was more like, well, these are my contracts that I've accepted. Really the business was, do I go on this insurance? Do I not go on this insurance? This is what they pay. This is what they don't pay. Am I willing to see patients for this price? Am I not willing to see patients for this price? And okay, should we give this raise, not give this raise? But at the end of the day, I really had not a lot of control over everything else. It was just like, well, this is the cost of doing business. This is X, and Y. This is how much we get for doing the business that we do. And there's no real way to change that in their traditional model unless you either cut staff, and then your customer service goes to crap and patients leave you because I mean, have you ever been to a doctor and you're like, I like the doctor, but man, their staff sucks. Yeah. And it's generally because, not that their staff sucks, it's because their staff is they're understaffed. And this was before pandemic, and everybody's understaffed now, right? But they just like, golly, if I add another person, I'm not making anything. Like, this is just not worth it. And so what do they typically do? They choose to go short staffed, which throws everything into chaos, or they see more patients. And it's like, well, okay, now, and so at expense of what? You either got to work more hours, which increases your overhead because now you're open more time. You got to have all the employees there. What they choose is like, I'm just going to see them faster. I'm going to spend less time with my patients. And I remember making that decision during my career. It was like, oh my God, if I want to make more money, I'm going to have to see more patients, and, I'm not going to extend hours. So, all right, instead of giving everybody 15 to 20 minutes, I'm going to give them 10 to 15 minutes. And you make a conscious effort to churn and burn is what we call it. I got to churn and burn. And, I don't know, that's not the way I wanted to practice medicine anymore. I was kind of ashamed that it got to that, but we also had to do what was right for the clinic. And luckily now I don't have to do it that way.
So what do you see as far as a trend of traditional physicians transitioning to a cash pay practice?
Well, the trend is that providers are still leaving the field of primary care medicine at an incredible rate. Providers are retiring much younger than they normally would have, simply because they're very, very, they just can't do it anymore. They're tired of the situation. So, guys or girls that would normally work 5, 6, 7, 8, 10 years are like, you know what, I'm just going to do something else. And two, we are seeing a tremendous amount of providers moving over to this model. Every time we go to conferences and things where, dealing more in the cash pay model, attendance is doing nothing but going up, up, up. It's not going down. This is, 5 years ago, most people that I talked to, when you said a cash pay model to patients, they would be like, what? Like, what is that? Not at all anymore. I mean, I think that most average consumers understand the model now, the advantages, disadvantages of it. Maybe they don't understand it enough, but they at least have the general concept of it. So it's a field that's growing tremendously, and it's gaining steam, and it's going to do nothing but continue to increase.
All right. So if I'm a provider thinking about this, what are a couple of good conferences that I should consider and where I can learn more about transitioning from a traditional practice to a cash pay?
Well, the big brother on the block is A4M. A4M is easily the biggest one, and like this podcast, we're in September. They have their huge conference in second weekend, I believe, in December in Vegas, and that's a really good conference for providers to go to, not only to get exposed to this kind of medicine, but also get exposed to cash pay practices. And it has the most amazing exhibit hall that it's worth going just to go to the exhibit hall, because you see things that you don't you just won't see otherwise. And I think it's the one I always recommend. If you have a limited budget for your CME and you've only got like $3,000 to spend, then go to that one. Go for the bang for the buck. AMMG is another one out there. They have 2 or 3 conferences a year. That one is a very much like A4M, but much smaller. So usually A4M in Vegas will have thousands of practitioners there. AMMG typically has a few hundred practitioners, so like 200 to 300. I personally like AMMG better just because I know many of the providers, whereas it's just like a sea of people at A4M, although we do like going to the A4M December conference. SSRP, which I'm part of, which I think is an amazing thing if you're wanting to know more about peptides and hormones and just general cash pay procedures. I think the biggest thing is if you even have an interest in this, is expose yourself to it. Find out what you like, what you dislike. Find what your passion truly is. There's something in there that's your passion. And if something is truly your passion, you never work again. And that's what I've learned. Days that I get to do what I really, really want to do, those days fly by and they're fun. Never felt like I worked at all. Still at times where I'm doing things that maybe isn't my favorite thing, the day kind of drags on. And so, that's the biggest piece of advice I'd probably get. Mistakes that I made early on is going over the cash pay practice. I maybe made some decisions based off of finances, not passion. Oh, if we add this service, it's a good service and it'll make us some money. If I could go back and guess what always happens in those scenarios? If it's not your passion, you will not recommend it. You will not sell it. And it'll end up being a negative draw on your practice. But if it's something that you 100% believe in, 100% love and are passionate about it, you will sell it without selling it, just because you believe in it that much. Anybody that knows me, if you get me talking about hormones or peptides, you better have 20 minutes because I truly enjoy talking about it. And I really don't ever get tired of talking about it. That's what's kind of cool about it. So, A4M, AMMG, SSRP are 3 of the big boys on the block that all are very good conferences. I think everybody should do their research and look at all those websites and figure out what works best for them.
All right. And talking about your practice, you have 2 locations, and maybe I'm a physician that was listening to this and I've been looking for a doctor for myself because I want to take more ownership of my health. Tell us about your 2 practices.
Yeah, so our home base has always been here in Texas, and it's Weatherford, which is just right outside of Fort Worth, Texas. The 2 towns are slowly merging because everything is growing so rapidly here. So we have our Weatherford office, 10, 12 minutes to the west of Fort Worth, and this is home base. And then we've also launched, and here, we do a plethora of things from personal training to IVs, to hormones, to peptides, to aesthetics, and more. And then Nashville, we've launched, and I have an amazing nurse practitioner there, Nancy Boyden, and we're really concentrating in Nashville on wellness, peptides and hormones for those patients, just trying to get our footing there and basically seeing where that practice grows. But we can do a lot for patients with that platform.
All right, Dr. Kris, as usual, this was a great conversation. I really enjoyed talking with you and learning about it. We're all interested in our health, but we often don't have someone that'll just sit down with us and discuss it. And I think that's what one of your strengths are. So we really appreciate these conversations with you.
Well, thanks, Steve. That's nice for you to say, and enjoyed today's podcast.
All right. So wrapping up another episode of the Dr. Kris Life podcast, where you can learn how to take more ownership of your health and your practice. Be sure to follow us on Buzzsprout. We're on Spotify, all the places that the cool kids have podcasts, YouTube channel, and be sure to check out the resurgeclinic.com to learn how maybe you can visit Dr. Kris yourself. Dr. Kris, any last words?
No, just have a great rest of your week, everybody.
All right. And that's a wrap. Thanks for joining the Dr. Kris podcast. If you learned something today and you want to connect and get more information, visit our website, www.drkris.life, where you can find more great information or even schedule a time to learn how you can engage with Dr. Kris. Be sure to follow, like, share, and we'll see you on the next episode of the Dr. Kris Podcast.